This is the Mend It Pass podcast with Chadwick Hayward, episode 14.
Road to menditpass.com. Let's get back to bedtime.
Hi, Path Menders. Thanks so much for tuning in to the 14th episode of the Mend It Pass podcast. This week, I'm speaking with Dr. Jaimela Dulaney, a cardiologist based in Port Charlotte, Florida. Dr. Dulaney's practice is differentiated from many cardiologists by her emphasis on plant-based nutrition education. She offers a 6-class nutrition program as well as a 30-day intensive program that teaches the importance of diet in disease formation as well as its treatment and, more importantly for her patients, its reversal. This has allowed her to reduce the medications of her patients while at the same time resolving their angina. Jami also believes that exercise is a vital part of a healthy lifestyle and is herself a marathoner. She has her own podcast, Jaimela Dulaney, MD, Plant-Based Wellness, and can be found on her website, drdulaney.com. Well, hi, Dr. Dulaney. Thank you so much for joining me today.
Well, thanks for having me.
It's great to have you on the show. So my understanding is you got into medicine in part because of your grandparents' medical histories. Do you want to give us a little bit of background about how that kind of started?
Yeah, I come from a family of diabetics. My dad and his mother, who I spent a lot of time with growing up because my parents worked, she had diabetes, and my mom's mother had diabetes, and I didn't even know my grandfather because he died of a heart attack at 46.
Oh, no.
But I remember as a kid, going to the emergency room with my mom's mom, either in diabetic pre-stages of coma and then heart failure, and then I would wait in the waiting room. And so it was always something that I was around and, maybe didn't understand. And then my other grandmother died of a massive heart attack at 78. So I pretty much... I was very interested in trying to, keep that from happening to other people's grandparents, and treating it. But how to treat that, has evolved, obviously.
Of course, yeah. So that kind of led you into medical school. Did you know you wanted to be a cardiologist right away?
I actually always did. My daughter always, kind of gets irritated. I was one of those kids that, anybody that went to college in my family were teachers for the most part.
Okay.
But I always knew I wanted to be a physician, and I always liked cardiology. And I think that was the reason. When I got into medical school, other things were attractive, but ultimately, I came back to cardiology.
Okay. And so you started your practice and you basically, you were like a typical cardiologist. You treated problems, you saw it as a progressive illness, managed symptoms, I would assume.
Yeah, absolutely. And I thought I did a great job. I started out in academics, doing echocardiography and stress testing and, of course, treating people aggressively with medication, statin therapies. I was always aggressive trying to get their cholesterol down. I recommended diet and exercise, but it was you should exercise and, eat in moderation, more of a Mediterranean type thing. So that was, basically the extent of it.
And so did you practice what you preached at that time?
Oh, yes. I always was very fearful that I knew that if I got overweight, my dad's side of the family were, I should say, big Irish people. And so I knew that if I got overweight, I was going to get diabetes. And it was one of the reasons. I was always active. I always have liked sports and things, but it's one of the reasons why I started running, just to stay in shape and, head of the curve with diabetes and, high cholesterol, as, kind of was the aim. And I always thought it was important as a cardiologist to set in a good example.
Yeah.
I started running marathons, and I would frame the T-shirts and the medals and put them in the office, hoping to, if I have time to go and run, then anybody should have time to go and run. And, so that was always the thought of the process. But yes, I've always thought that a physician should lead by example.
Did you notice any of your patients getting that by osmosis? Did more people pick up exercise because of your efforts of like putting your shirts on display and whatnot?
No, not at all.
No?
No,
That's too much, they thought.
Yeah, well, yeah, and the funny part about it, it actually backfired to the point where they would see the medal. The first marathon I ever ran was the Rome Marathon, and the medal was kind of bronze looking.
Okay.
And so some of my older patients, because I'm in Florida, and a lot of cardiac patients are older, and they say, "Were you in the Olympics?" And it's like, because they think Rome and Olympics, and it's like, no, and it's like, well, did you? I ran the marathon. What did you win? There's a medal. No. And it's like, what place did you come in? And it's like, well, I don't know, 12,000, 10,000, who knows?
Did it work with combating your own family history of diabetes and high blood pressure and that kind of stuff for you personally?
Well, certainly my weight is under control. But, one thing that I quickly learned and also passed on to my patients was that, even running 40, 55 miles a week, I could eat through that on a standard American diet, so I didn't lose a tremendous amount of weight training for a marathon. I mean, I never let my weight fluctuate up. I've always kind of been one of those people that, kind of kept control of portion size or what have you. But what I did notice was that my cholesterol was actually starting to creep up despite it. So I was starting to go LDL, which is the bad cholesterol, over 100 despite running. Oh, wow. And actually put myself on Lipitor and, thought, well, this is, my mother took Lipitor and heart disease runs in the family. So as long as I keep this in check, I'll be okay.
Yeah.
So I actually took the Lipitor and, that's, kind of.
I guess it was effective at lowering your blood cholesterol, but it wasn't really treating the underlying problem.
Exactly.
And so how long did that go on for before you started to wake up to nutrition had a much bigger impact than previously thought?
I stumbled. There was a girl in the cath lab, and she was a vegan, an ethical vegan. And she had talked about the book by Diet for a New America by John Robbins. Okay. And I read that book, and that's when it changed for me personally. So that was probably 3 or 4 years, maybe not that much, maybe a couple years into me taking statin therapy, But even then I changed to being vegan. I didn't stop the statins.
No. Well, and you probably shouldn't just, if you change your diet tomorrow, you shouldn't drop all your medications. Like you should consult your doctor and right.
Yeah. I mean, I never, I changed. I guess it didn't entirely click as far as reversing the disease so much as that I was like, well, these statins are really going to protect me, so I'm going to keep these going for now. Oh, okay. And that was kind of the my thinking at the time, and I guess I wasn't sure about what results I would ultimately have either.
Fair enough. And so, was it more of an ethical stance for you at that point?
Yeah, I think it was. Really, the factory farm thing really shocked me. I knew nothing of that. And then the health reasons, I think the thing that hit me early on was the cancer risk and the osteoporosis. I knew about protein, high protein and worsening kidney function in people prone to it. So that made sense already. But, I really have to say the heart disease factor probably didn't click in as much.
Okay. And was that maybe a symptom of you're a cardiologist? If there was a connection here, you would have already known it, that kind of mindset, or?
I don't know. I guess, I was just going to we're so trained to aggressively treat things medically that I guess I just thought things were under control there because I was taking a statin. So, that was something I probably, had under control and didn't think about it. That book led to, and I had read, and I'm not sure when Dean Ornish's book came into my library, but that was probably the next one, and reversing heart disease, and even that didn't click in for myself, and I saw that, and I recommended that to some of my cardiac patients at that time, but I didn't have much faith that they would actually adopt it, and I even presented it as this is a great book, and this guy has shown the ability to reverse heart disease through diet. But it's really radical, and it's really strict, and I'm not sure you can follow it.
Yeah, and Esselstyn's diet is really strict.
Yes. But I didn't. I had never read his information until I was running. I listened to podcast, and I just happened to be listening to a podcast, and they were talking about this new documentary, Forks Over Knives. And so I came home immediately and, rented the movie. And, and that was really the giant light bulb that came on. It's like, okay, this is how I want to practice. And this is what my family's going to do. I mean, the whole, that was the giant awakening.
I guess I jumped there from Dean Ornish to Esselstyn because I know Esselstyn has the really strict heart healthy diet. I'm not actually familiar with the specifics of Ornish's diet. So is that similar or?
Yeah, it's very similar. He's a little bit more liberal, when it comes to nuts. He's not in past books. Some of his earlier editions, a little bit of fish here and there was okay. He doesn't really recommend it now. He does his claim is a kind of a more of a 3-pronged approach. Both nutrition and connectiveness and movement, so
okay.
It's more of a full body approach to the cardiac patient as opposed to, being very specific on nutrition in general.
Okay. And so Esselstyn got brought into your life through a podcast. And so you watched Forks Over Knives, and that was kind of the light switch moment for you and your family?
Yes, it worked. Like, we're all going to do this. And the other thing that happened, in the midst of all this. And I had, after John Robbins, I had kind of become vegan. And I'll say vegan waxing and waning a little bit, on my own vegan, around family, trying, kind of a closet vegan a little bit. I declared it, but
more flexible.
If, my mother had something and my Italian mother, as far as, if even the Irish side of my family, it's, it's all about food. And if you don't eat it, then, what's wrong with it? Why don't you like it?
Yeah.
So some of that would, I kind of go back and forth and sort of slip off the wagon a little bit. But once I, saw Forks Over Knives, it's like, no, I'm all in, and I'm all in strict. And at the same time, my mom was diagnosed with lymphoma.
Oh, dear.
And my father had Alzheimer's, and they were living with me in a grandparents' suite. And when my mom and I actually shared the cooking responsibilities, I do so many nights, she do so many nights. But when she got sick, I started doing all the cooking. And when, she was going to start chemotherapy, it's like, okay, we're not going to have any animal products in the house. And I presented it in such a way because I'm not going to take the risk of salmonella, E. coli, and contamination of the household with things that could cause you to get sicker.
Okay.
And I really do believe that if you're going to fight this cancer with the chemotherapy, you need to have the most nutrient-dense diet possible.
Yeah.
And the least amount of toxins and the least amount of risk. So, henceforth, we're plant-based. This whole household is now plant-based. And I actually declared it then, and it has been ever since without falter.
Oh, that's awesome. So what was the time frame between becoming a closet vegan, let's call it, and watching Forks Over Knives? Was that years, months?
Oh, I'd say a couple of years. It was at least a couple of years.
And so were you a junk food vegan during that period of time?
No, I've never been a junk food. I've never been a junk food person at all. Again, I would, eat the vegetables, and, I wasn't much of a fruit eater at that time, but I would just try to stay away from the meat. And I had no really rhyme or reason of it. I didn't have the focus on greens, but I've always been a pretty big salad eater. We've always had a lot of vegetables with the meat, so it wasn't really hard to kind of pick around it.
Okay.
So I guess I wasn't strict, when it came to the biggest thing. My biggest downfall at that time was pastries. I had a really bad sweet tooth, growing up. I'll go back to my grandmother, the diabetic, who was, fantastic baker. And so there was always pies and cakes around, and I always tease my patients and say, growing up, I never ate fruit that wasn't in a pie. And, so I had a sweet tooth. I mean, I would have chosen chocolate cake for breakfast over, just about anything.
I'm pretty sure at some points I have eaten chocolate cake for breakfast. So.
Yeah. I mean, the old Bill Cosby, that skit where it has all the good stuff in it. So, I was right on board with that. And, and I loved ice cream, so those were the two things that I was always, once in a while this, once in a while that.
Yeah.
And the pastries, I didn't, even though I knew there were eggs or butter in them, I kind of turned a blind eye to that.
Yeah. Okay. Until you watched Forks Over Knives.
And until then, and it's like, okay, this has got to go.
So in that interim, did it impact your practice at all, or it was after the Forks Over Knives experience?
Yeah, it was after the Forks Over Knives experience that I actually, when I heard Dr. Esselstyn talk about his patients, that, if you spend time with a patient and you explain to them the science behind plant-based nutrition, that in general, everybody, nobody really wants to be sick. Yeah. And if given the right information and the right support, then people will choose health, and they will be willing to choose the way they eat if they know the reason behind it. And you need to take time with the patient. And the way to do that, he felt, was, through his classes that he would have at the Cleveland Clinic. Yeah. So immediately I thought, that's exactly what I want to do. That's my goal. It didn't happen at first. I started doing it individually in the office setting. Okay. And it was very frustrating because I would try to give the whole Forks Over Knives lecture, to every patient I saw every day. Yeah. And, I'd be hoarse and frustrated. And, at the end of the day, I'd have one person that might have been a little interested. Yeah. So, I just felt like I wasn't really getting very far, so I probably had, I could count them on one hand, the people that, were interested in going plant-based.
Okay. So I can understand how frustrating that would be. Like, you feel like a broken record over and over all day. So how did you branch out and increase your effectiveness?
Well, I decided to just pull the trigger and start this class. And then I had been through a little bit of a hiatus in my own practice, or a little bit of an change in my own practice. I had been by myself for probably 10 years, 12 years. And when my parents got sick, I actually joined a group for a year and a half, which made, decision-making part of the group. And I thought I just wanted to be an employee, take care of them, and practice medicine and go on. And I found that I really wasn't cut out to do that. So I went back to my old office by myself. And when I did that, I decided, okay, so I'm going to have these classes like Dr. Esselstyn. So I started advertising with just my patients when I would see them. Hey, I'm going to have this class after work, and you can bring your spouse free. And we're going to talk about the science behind plant-based nutrition and do menu planning and go on from there. Yeah. And so I started that way, and then I realized I needed to provide some sort of they needed to taste it and see how it was prepared. So I started bringing food in, and then I started cooking in front of them. Okay. And that's kind of how it's evolved over time. And then we also go shopping. So there's 6 sessions to this course that I designed. And the third session, we all meet at the local grocery store and go through a Disney World tour, looking at the produce and talking about vegetables and what you would do with them, and reading labels and looking at things you shouldn't buy and things you could buy and things that trip you up. And so that's kind of how it's evolved.
And so what's your success rate? Like, has the success rate in convincing patients to go to this class changed over time, or?
Yes. So we started the class, so it's 6 sessions, and I was doing the classes every other week, just kind of fit in my schedule. So it would be 6 sessions, but over 12 weeks. Okay. And then we would just kind of go into another one. So we would sign, and we'd have about 18, 19 people per class. And then it got to the point where I was filling up. So I was actually doing 2 classes. Like I'd do one, 4 to 5, and then one to 5:30 to 6:30. Oh, okay. And so that way. And then now we've actually evolved to the point where we're doing them every week. And I've moved to a location where I can have more people. So there's about 25 slots available, and we do them every week and then recycle over. So yeah, people keep signing up, and then if people want to come back for a refresher, then I provide them that opportunity. Or if they miss a class, they can come back and make up the class, because I want it to be successful. The idea is not to just have a class to make money and teach people plant-based nutrition. The idea is to be successful, get these people plant-based and get them off their medications and get them feeling better.
So what's the success rate with the patients that do decide to go to these classes?
It has evolved. And so, I would say there's probably maybe 10% that are, maybe I strong-armed them into going to the class, and they may or may not try some things. They usually find it educational, but maybe are overwhelmed.
Okay.
And it's such a new thing, an introduction, so that not much change occurs. There are 10 to 15, 20% of people that are all in, that are just, come out the other end, weight loss, off medications, just, all pumped up.
Yeah.
And then there's that variation in the middle. So, and it's hard to predict, when I kind of, and they laugh because I tell them when they, we start that, I try to kind of size people up to see, who I think is going to do really well and who I'm going to have trouble with. And I even try to do, what I cook. I want to wow them at first, and get them on board as quickly as I can.
Yeah.
But I'm always fooled about, there'll be people that I didn't think were going to do very well at all that do fantastic. And there are people that, I really had high hopes for that I just don't make much of an impact.
Okay. So it's really a mixed bag with each session that you put on.
Yeah. And, and some things, sometimes people come back for a second round and that's when it clicks.
Okay.
And then, and the thing is, different things click for different people. There was one guy that, he was doing it and he was really sticking to it and he hated it. But he was doing it and until we talked about mushroom gravy. And when he found out that he could have like mashed potatoes and mushroom gravy, it was like, he was out of jail.
That was it.
And and so, it become like something he liked all of a sudden, because if he could have that, then the rest of it was really tolerable.
Okay.
And, and there was another person too, another guy that he came in and he's like, I'm doing it, and my numbers are getting better and I don't like it and I crave a steak every day, but I'm not going to. And it took about a year and he turned the corner as well. It's like, oh, I went and do it, and it's funny because you know how it is. Once people, the light clicks on, then they start to, tell their friends and, I can't believe my friends won't, they're all in on trying to get other people on board as well.
Yeah. I find that that's a very common theme where people, a lot of people have a slow transition and it takes time and they do that cheating phase and kind of, you get more involved as time goes on, but then you get the point where you're 100% and then you just want to shout it from the mountaintops.
Yeah, I agree.
So what percentage of your patients now do come to see you?
Yeah, the people in the class, probably 80% are patients of mine, and the other 20% come from outside.
Okay. And so do you find that there's a greater acceptance with people that are older or younger or any particular like other demographics that impact people's desire to learn more?
No, I've had some of my biggest failures with young people and some of my greatest success with people that are in their late 80s.
Okay.
And it varies, all across the board. Like I said, it is just extremely difficult to predict what's going to happen.
Okay. So, there's really no brush that you can paint your ideal candidate for.
I will say the more support someone has, the better chance they have for success.
Okay.
If I can get, a spouse and, on board, or somebody with a friend on board, then, or some other family member on board, then there's a lot higher chance as opposed to somebody that's going it alone.
Yeah, I would understand it would be very difficult to be that one person in especially in a household that is not compliant with that lifestyle. It would be very challenging to overcome that. And so after you've watched Forks Over Knives, did you notice improvements in your own performance with running and those kind of things?
Yes, recovery. Recovery is certainly a lot quicker. After a marathon, I'd kind of be, sore for over a week and, before. And, I would kind of do them. And of course, my running evolved over time too, so I just running longer, but it would, I would kind of be 3 weeks getting back into it. So I'd almost kind of lose all my fitness after a marathon and then, start to rebuild again. Okay. Where now, I take a couple days off, usually because of travel and I'm kind of right back at it. And I don't see, very few, if I have an injury, it's because I've done something stupid running, not really because of recovery, so to speak.
Yeah.
So I certainly feel better then. Tendency to get, infections are much less. I get occasional sniffles that last a couple of days, rarely, but it's, nothing that slows me down and keeps me from training or impedes my progress. So I think all that is very positive. I don't have any persistent joint aches or, anything that, people tend to get as they get on into their running career, as I am, I guess.
Yeah. And I assume you're off your medications now as well, off your statins.
Oh yeah. Yeah. I take no medications whatsoever. I don't ever take an ibuprofen or anything. If I, think that I'm getting a little niggle here or there, I like to kind of add turmeric and ginger to a morning smoothie. Yeah. But that's about as far as I go. I don't ever take anything for, any kind of muscle discomfort or something.
Food is medicine now. It's
yes.
Focus on anti-inflammatory foods like you mentioned, ginger and turmeric. So are there any particular patients that you would not necessarily advocate for like major nutrition changes? Like I can understand that there's probably some people with congenital heart issues that may not receive the same kind of benefit.
Yeah, I mean, they may not receive the benefit from a cardiac view from their congenital abnormalities, but certainly from an overall health, they still can get lifestyle diseases, hypertension, high cholesterol, and cancer. So, I don't see anybody, and I always tell people, it's like you're never too old to get benefit. And, I always give my mother's example, she's 83 and she's doing Zumba and,
oh, that's awesome.
She golfs and she's very, very active. So, I use her, and she actually now has started to come and help me out in my class. We call her, I call her my little Vanna White, 'cause she, helps serve the food and everything. And she's, and she provides a lot of support for the people too, because they look at her and see if she could do it, then they can do it.
Yeah. So what types of foods do you cook for your classes?
We start out with dressings, because people panic over what are they going to put on their salads and different things. So I teach them how to make oil-free dressings early on, and I also teach them how to make oil-free hummus, because then they have a snack or something to put on vegetables that's healthy, and they have a dressing to put on their salads, and that's also healthy. So that gives them I can do this part. And then I like the Instapot or the electric pressure cooker, and I make soup in there, because I like to show people that you can come home from work and get a meal on the table for your family in 30 minutes. So you can make a nice big pot of soup in an Instapot in 30 minutes. And so we do a potato leek, or we'll do a carrot ginger soup, or a variety of different soups. So they have a soup.
Yeah. So keeping it simple, essentially, is making
absolutely.
it easy for people.
And then we'll do I like sunflower seed meatless balls, or a tuna fish made with sunflower seeds, or a garbanzo bean tuna type of thing, or they eat a meatloaf, a lentil loaf type of deal.
Yeah.
So something that they can eat that's good, share with their friends, and it looks pretty. It's simple to make.
Yeah. So something that they're not necessarily going to have to spend 4 hours in the kitchen trying to slave over.
Yeah. And I also like to make different salads, because when people, say salad, like I always hear I eat a lot of salad. And it's like, so I ask people specifically, well, what's in your salad? And they'll, a lot of times it's lettuce, cucumber, and tomato, and that's it.
Okay.
And, so I like to make a salad with bok choy, with some fruit, or, a kale with some lentils. So I try to do different kinds of salad, or a Mexican salad, or more of an Asian salad. So, or with cabbages. And so they seek salads that are different, with different dressings that taste good, but they're still eating a salad, so to speak.
Yeah. Yeah. The term salad is such a blanket term where there's so much potential variety there, and most people stick to iceberg lettuce and a couple of other ingredients.
Yeah, and they're so afraid that they're going to starve to death, which, I say, because when sometimes people will say, well, we go over what people had to eat, the previous week. And certainly in my office, I always ask, what did you have for dinner last night? And, a lot of times people will say, well, they had the salad with lettuce and tomato and cucumber. And it's like, well, I would starve if I just ate what you're telling me, So let me, and then I'll say, well, let me tell you what I had to eat yesterday. And, they're like looking at me like, how did you consume so much? And it's like.
And so what did you eat yesterday or today?
You want me to? So for breakfast, I actually had teff, which is a kind of an ancient Ethiopian grain. It's kind of like cream of wheat, but it's more of a whole grain. It's dark, okay. And I make that with walnuts and dates and raisins and nutmeg and cinnamon. And so I kind of make we had extra on Sunday, so I take a little bit of that, and I always add fruit to it. So I had some blueberries on top of that, a little banana. After I run in the morning, I always have a smoothie, and it's usually whatever fruit I have and kale and a little flaxseed. So, today we're kind of running a little bit sly. So it was basically banana, blueberry, and kale with flaxseed. A little ginger in there.
That's the exact smoothie I had today, actually.
Yeah, and then lunchtime I had actually a leftover Reuben that we had made the other night. So we had tempeh Reubens. So it was a piece of tempeh with sauerkraut and beets and tomato. And then I had a Swiss chard salad, because Swiss chard is growing in my garden now, with some cucumber and pepper. And for dinner, my mom actually cooked, and she made a dish with potato, onion, and peppers kind of baked together. And we had green beans and a lettuce salad with tomatoes and onions and cucumbers and peppers, and then a broccoli, carrot, cauliflower medley.
Wow, that sounds incredible.
Yeah, so I ate a lot today for, not that big of a person. So yeah, I eat till I'm full, and if I get the nibbles later on in the evening, I might have another smoothie, or, I like, I've got into, I guess they call them acai bowls, where I'll take a piece of fruit, my favorite, if I can find them, dragon fruit, and just put that in the blender with ice and kind of make a soft serve with it, then chunk up fruit like banana and blackberries and some unsweetened coconut on top of that and eat that. That's like a really great dessert. It's kind of like I'm eating that old ice cream, but not really.
Yeah. Yeah, my favorite is frozen cherries with just a little bit of like motherless milk, cashew or almond, and a frozen banana, and it just makes incredible ice cream, quotation marks around that. Yeah, and I'm perfectly satisfied, and I've come to realize that really it's the cold that you really crave. It's not the cream part; it's the cold part. Yeah, it's an experience to eat. It's a treat. So what's the biggest eye opener for most people when you take them shopping?
We always find vegetables that people haven't, and I'm really surprised every time, the vegetables that people don't know the names of or have any idea what to do with.
Okay.
So that would be the first thing. And so, one of the students, came back around. It's like, because I'm kind of going through it quickly, and sometimes you kind of assume that people know more than they do.
Yeah.
And so I start rattling off recipes with whatever, and it's like, well, you got to slow down. I need the recipe. And so we go on from there. But, and then the other one's looking at, the ingredients in the back of things, how much hidden oil is in processed foods.
Yeah.
And, when they realize that, can I have this, and they'll go into the freezer section and pull something out. And it's like, well, let's look at it. And, I'd rather you not do it. But this is an alternative. So, I always try to provide an alternative, so if, that one bean burger, you could make it like this, So, I want to provide people with an alternative to what they would have eaten.
Yeah, you're not just telling people you can't have that. It's replace it with this. Well, that's awesome. So you said those classes are 6 weeks long, right? And so you said just one day of it is the shopping experience?
Yes, I just do shop on the third one. So we do 2 classes. And I start with the science. We start with endothelial dysfunction and, the arteries. And, each class we direct, we look at cancer markers, we look at diabetes and the mechanisms. And then there's the cooking part of it. So we have 2 classes like that. And the third one, we go shopping.
Okay.
And then, the fourth one, we kind of recap what happen shopping, and I usually go over the recipes that I talked about and try to kind of, write some of those important ones down.
Yeah.
And then the last classes, the last couple sessions, I encourage, the class to talk about what they've eaten and share their menus with the other classmates so that we can come up with, 5 or 6 meals for them for the next week. And, we talk about, what their challenges were with preparing the meals. The social aspect of things is huge.
Yeah.
How do you get around that? What are the pitfalls? And the last class is actually, I call it the final exam. But it's more of like, how do you go out in the world as a plant-based person? How do you deal with holidays? How do you deal with, family get-togethers?
Okay.
Declaring this is what you're doing, so I try to prepare people.
That is the hardest part is trying to fit in a world that is not whole food plant-based.
Well, and the biggest surprise that I've had socially is the adult children of my patients not accepting their parents changing their nutrition.
Yeah.
And this seems wild to me. If you had a parent that wanted to be healthy, why would you not support that? But, it's people don't want to hear anything bad about their bad habits.
Yeah. And I think that's what it is that that negativity is a reflection on themselves. They see that this is contrary to what they're doing, and therefore, if they're not acting that way, then because their parents are doing it for health reasons, they're not being healthy, and they don't want anything to do with that. So they try to reject that new lifestyle as a way of blinding themselves to the fact that they're leading not necessarily healthful lifestyles, which is obviously the case with the standard American diet. So
yeah, I agree.
So do you advocate for a spectrum on switching? Like, are you saying you're better off obviously you're better off going 100% whole food plant-based, but do you advocate for like incremental changes for people?
It's tailored to the individual somewhat,
okay.
Because there are people that I really have to take along slowly, or they just wouldn't go at all.
Yeah.
But I really am a true believer in let's just go for it and declare it. Because I think if you try to be the closet plant-based person, the closet vegan, it's just too easy to say, I'll have the whatever.
Yeah.
And especially, the sicker you are, the more you have to be, the more benefit you get quicker.
Yeah.
And certainly if somebody's having angina, then we need to get them, on the right path very quickly. And they see the results then. So when their chest pain goes away or their diabetic neuropathy goes away, then they're much more likely to embrace this and say, wow, I feel great. As opposed to, I'm not really seeing much, maybe dropped a few pounds here, but this is hard. And, so I really like to shoot for the moon and then pick up the pieces as we need to. Okay.
And so do you think like in starting the program, do a lot of people on initially and then give up if they're going to give up, or do they just not jump in?
It varies.
It varies.
Yeah. I had my last class, I had this one woman that really was a junk food eater, and she ate out most of the time. She had a bunch of buddies that liked to eat out, and the biggest step, it took 2 weeks, maybe the third week before she walked into a vegetable market and looked around and left without buying anything.
Okay.
And then, then she got a veggie burger. And then, by the last class, I was so excited because she actually made a meal that was plant-based.
Okay.
So, that's how slow it went. And really, that, and then, I have people that, try that they're going all in, and it's more of a learning curve. I didn't know that had oil in, or, I didn't know that, it's just,
inadvertent slip-ups.
Yeah. So they just were fooled, or they went out and they couldn't believe it, they start to see how they're, being fooled, so it's a spectrum.
Okay. And so I guess, is this bad for business?
Yeah, I had a cardiologist ask me that what's going to happen if, all the people start eating plant-based and we don't have any patients. And No, I like to say that my success rate is that I'm just like knocking them off at 25 at a time, that, I'm just curing people. And so if, if there's, 200,000 people in my town, then I can, 25 a clip, when am I going to have it all fixed? No, I think it's an uphill battle.
Yeah.
The best thing that happens to me is when a patient is shopping and somebody overhears them talking about vegetables and asks them, or, everybody that goes through the class gets a T-shirt, and my T-shirt logo says, my heart beats on plants, and it's got a little EKG line through it, and awesome. It has the vegetables. And so people will inquire about that T-shirt, and that gets a dialogue started with people.
Yeah.
And, to me, that is the greatest thing. And, I'd love to be put out. I tell people it's like the most fun I have every week is that class. And if I could just do that, and, I would be so happy and see the success, because, you talk about, an ego builder, I can take people off their medicines,
Yeah.
Did your doctor do that before? No. So it's a great, it's success, call it what you want. I don't need to have a near-death experience with a patient to be successful, Yeah. That's what makes me happy, is to see people doing well. And, there's a lot of people out there that, all you have to do is go. I just was doing a little shopping this evening at, we have a Sam's. I know people have Costco. We have a Sam's here in town. And I'm just looking around at, it's all processed foods for the most part there. They have a vegetable section, but it's pretty lonely there.
Yeah.
And, I look in people's carts all the time, and I see it. And it's all I can do not to go up to them. It's like, this stuff's killing you.
Yeah. I find it very challenging being in line at Costco as well, where it's like, I'll look over to my wife and I'm like, look over there. There's absolutely nothing healthy in that cart, or the opposite. You find someone where they do have a healthy cart, and you can't help but comment on it kind of under your breath, but you don't want to really you don't want to be that guy that's
Stalker
going
mode.
up, right, stalking other customers. And it's like, you probably don't need 5 dozen eggs from Costco.
Well, the funniest thing, I did have a patient that somehow, just start talking to a random person, and my name came up, and they looked in the guy's cart, and he's like, "You're Dr. Dulaney's patient. You can't have this stuff." And so they actually took them back like through the aisles to put the stuff back on the shelf and to buy alternatives. So I thought that was pretty cute one time.
That is awesome.
Ultimately, it did not work. It did not. They came to a couple classes, but I'm sure they're back in the wrong aisle at Sam's. But.
Oh, that's unfortunate. Well, how long have you been teaching these classes?
I think we're on. We're well into our second. We're almost at 3 years.
Okay.
Yeah.
Okay, so yeah, the numbers are creeping up there, where quite a few people in town would have attended.
Yeah, now I'm actually getting people to come as patients. They come because I'm plant-based, as opposed to, they come in and I, the shock and awe, tell them about the forks over knives thing. So most, a lot of patients come because of that they want a doctor that's plant-based, or they want to get off their cholesterol medicine and nobody else will support them.
Okay.
And some people are even coming because of my podcast, that, they're someplace in the Florida area, and they'll come over just to, kind of check in and go through things.
Oh, that's awesome, because the success rate is obviously higher amongst those individuals that are
Yeah, it's always a pleasure, it's always exciting to, preach to the choir.
So someone who isn't coming to you because they're plant-based, what's a typical patient for what brings them there? Is it a heart event that makes them come in?
Yeah, typically they have chest pain, heart failure, shortness of breath, swelling of their legs, uncontrolled high blood pressure. So when I see people in consult, it's usually because they've kind of failed their primary care visit, so to speak. The primary care is trying to do a few things, and they flunked a stress test, or their blood pressure still isn't under control.
Okay. Yeah, so it's you're a specialist secondary recommendation, essentially.
Yes. Most of the time, it's a referral, but people can still choose who they want to come see.
Okay.
Most of the time, there are some insurance limitations here even. But then, there are plans that people can just come and see a cardiologist. So you have high cholesterol, high blood pressure, and you're like, I want to see a cardiologist. And you can just come and see a cardiologist.
Okay. So, well, good luck on increasing your success rate with getting patients over to that nutrition class. It sounds like a lot of fun and a lot is learned there.
Yeah, I'm learning too. I'm learning different, it's the way I approach things changed too. And my ability to, it's a whole new ball game. As a physician, you're an educator from the get-go.
Yeah.
A little bit of, you ask questions and you come up with a plan, but your approach to people, makes all the difference in the world. Who do you support? Who needs a little bit more tough love? Who needs a little bit more easy there? It's okay.
Yeah.
It's been a great learning experience for me. I get to know my patients better, and when it's after hours, so to speak, the white coat is off and I share my family experiences. They share their family experiences. So it increases the bond, so that makes it even better as far as a patient-physician practice. I had a guy, this week that had come in and had been, a little bit off the wagon, not horrible, but a little bit off the wagon, more into the vegan junk food and gained some weight. And he actually said, I really felt bad when I left because I think I disappointed you, so, and it's like, no, you're human and, we'll get back on the track, but so that's nice. That's really nice when, you get that bond with somebody that they want to please you as well as, do well for themselves.
Yeah, you're really adding value in their lives for sure. So someone is listening and they're considering changing and mending their own path in correspondence with the podcast. What advice would you give to someone that's on the fence?
One, watch Forks Over Knives. The new movie out, I think Food Choices is pretty good as well, but Forks Over Knives is just, hands down, I think a life-changing movie for people. Yeah. And then start reading. I like that website. I refer people, I have a little script pad in my office that has nutritionpacks.org. Go to that website, watch some videos, look at listen to some YouTubes by Dr. Greg or Dr. McDougall or Dr. Clapper. Listen, hear a variety of different, YouTube videos, check out different podcasts, listen to my podcast, read all you can and make your own decision.
Yeah. The more you learn, the easier it is to adopt a new lifestyle.
Yeah. And get some support. So if you don't have any family support, get the Facebook or the Instagram support. I post my meals on Instagram. So if people want to see what I eat, I try to put, if I can remember, if I just don't dig in at first, if I can remember, take a picture, but.
And I'll link that on the podcast blog page. So
good.
Awesome. Well, thank you so much for taking the time. I really appreciate it. It's been great to speak with you today.
Oh, it's my pleasure. I enjoyed it as well. And, good luck to you and your mission.
Thank you very much. Take care.
Great. Thank you.
That's all the time we have for this week. Thanks so much for tuning in to the Mended Paths podcast at www.mendedpaths.com. If you've enjoyed the show, please share with your friends, family, and the world. See you all next time.
Visit mendedpaths.com and get back to bed.